scientific consensus is clear. Human health, domestic and wild animal health, plant health, and the health of our environment are deeply connected. This means they cannot be addressed in isolation, as they form a common system that demands to be treated as a whole. This integrated approach is known as One Health. There is strong scientific evidence for the benefits of applying a One Health approach to policymaking in all the areas affected, from health systems and food production and safety to zoonotic diseases, antimicrobial resistance, neglected infectious tropical diseases, and the environment. Of course, the question is, how are policymakers reacting to this mounting evidence? Do we have the structures that we need to take account of these developments, or should we be adapting our structures, or at least our practices? Are there forms of management and cross-sectoral collaborations that will be better reflecting this connection? And of course, are there any trade-offs, any unintended consequences, and we also might need to consider? For this reason, the Commission needed advice, and it solicited the Scientific Advice Mechanism, also known as SAM internally, which is, and it is good to highlight, unique in its kind, knowing it provides independent scientific advice on complex issues concerning multiple policy areas and backed by the latest science and interdisciplinary research. At their release in November last year, the SAM Evidence Review Report and Opinion on One Health Governance in the EU gained lots of attention. We are here today in this live TV debate on EBS, and we will explore the policy recommendations of the Scientific Advice Mechanism and how they can be implemented at the EU level. I'm very happy to introduce you to today's very distinguished speakers. We have Nicole Robert, who is the chair of the Chief Scientific Advisors, the GCSA, Professor of Nanomaterials, University of Oxford. Welcome, Nicole. We have Jakob Zinstag, who is the co-chair of the Science Advice for Policy by European Academies, the so-called SAPEA Working Group on One Health. He's a professor at the Swiss Tropical and Public Health Institute, University of Basel in Switzerland. Welcome, Jakob. We have Sandra Gallina, Directorate General for Health and Food Safety. Welcome, Sandra. And last, certainly not least, Kurt Vandenberg, the Director General for Climate, the so-called DG Klima in the European Commission. So, Sandra, as promised, I will start with you for the first question. And the first question is, why did you need policy advice from the SAM, the Scientific Advice Mechanism, to inform the EU health policy and more widely the EU policies on One Health? And second supplementary question, what triggered the former Commissioner Stella Kyriakides' request for a SAM advice?
Thank you, Johanna, and welcome to all of us here, and my sincere thanks to Professor Grobert for the good work and to the scientific advisors, and nice to meet Professor Jakob today. So, very simply, I would like to say to you all that One Health is not a discovery. We've been working with One Health for many years in my DG. The issue is that, we have zoonoses that we're dealing with, and we have also antimicrobial resistance. I limit myself to these 2 points. And here, I would like to mention that in the future, but even now, we are experiencing an increase in zoonoses. Many of our human infectious diseases stem from zoonoses. I wanted to quote a few for this moment together, like Ebola, COVID, or, for instance, flu, or I would say diseases that would not be suspected as from animal origin, like AIDS. I think that the real trigger here were numbers. We are seeing that numbers of zoonoses go up, but also the numbers of people that cannot be treated because of these bacterials that resist to antibiotics, what we call antibiotic resistance, antimicrobial resistance. This triggered these numbers, over 35,000 people possibly dying because of this. The cost of that, the cost is also a big part of the equation, triggered us to go to scientists and to say, listen, we would need better governance. We would need, I would say, better management of this situation in a European context. So what is your advice? And I would say definitely the Commissioner Kyriakides decided to address herself to the SAM because, it's quite a trusted and with a high reputation, for such a complex issue.
Thank you, Sandra, for introducing the topic. We are obviously quite short for time here. I know that you would have had much more to say. But just to now turn to Jakob, the scientific opinion on One Health governance in the EU is informed by a comprehensive evidence review report prepared by the Horizon-funded SAPEA consortium of the European academies. And this is why you are here with us, Professor Zintak, and you were the lead, actually, for gathering evidence here as co-chair of the SAPEA Working Group on One Health. So, over to you now, Professor Zintak, and maybe my question to you would be, what is the latest scientific evidence when talking about One Health approach? Can you tell us about the evidence you found in relation to its added value if applied to EU policies? And you have all of 3 minutes for that.
Well, it's a great pleasure to be here and to respond to that question. And indeed, if we consider the sectors of the European Union policies like public health, animal health and the environment, there is indeed evidence that shows real benefit if these sectors work closer together. I mean, wherever we find benefits of a closer cooperation, we should also do it. We would save money, we should save lives. And the highest benefits come clearly from what you said, the diseases that are transmissible between humans and animals, the so-called zoonosis. And there we can treat humans that get ill, but we will not interrupt the transmission. We can never eliminate these diseases. So we have to treat them at the root. And we could show that if you treat livestock, sheep, goat and cattle, if you vaccinate them, you can prevent the transmission of brucellosis, for example. And if you do the economics, you see that this intervention is profitable at a rate of 3 to 1. So for every euro you invest, you can save 3 euros in turn. So but you must cooperate between doctors and veterinarians and environmental and social scientists. The other strong example is rabies control. For the case of Africa, we could show that if we would go for a coordinated mass vaccination of dogs, we would have an extremely high return to investment rate of 14 to 1. You could treat all the humans with post-exposure prophylaxis after a bite, but again, this will never interrupt transmission. But if you invest in the coordinated between-country mass vaccination of dogs, you could eliminate the disease. And this is not utopic. Africa has just eliminated rinderpest in 2010, so we can do it. It's just a matter of political willingness. And then we have a beautiful example in Italy. Italy has already started integrated surveillance of West Nile virus in mosquitoes, birds, horses and humans. And in this way they can accelerate the time to detection, prolong the time to first exposure and reduce the burden. And in this way they save money.
Professor Zintak, I have to interrupt you because you're very convincing examples already that you have given us. But I'd like you to say just in 1 minute a few words about the evidence collection exercise itself. What were the main challenges to produce this evidence review on the topic?
Well, One Health, I would say, is a disruptive concept because it jumps over disciplines. And it is so that doctors still study only humans, veterinarians only study animals, and we have to bring them together. So there are few research groups in the world that really do that. But then we scrutinized the policies of the European Union, and they are not called One Health, but they contain already a lot of One Health. So we have the Green Deal, we have the Farm to Fork, and all them, if we look in a closer way, they have a huge potential to, if they are really put into place, to make further savings.
Thank you very much, Professor Sintak. I now need to turn to Nicole. And Nicole, you were the chair of the group of the chief scientific advisors, and you were actually leading on this scientific opinion. So from the, if you like, the trigger to the evidence, now to the recommendations. And may I ask you to do the impossible? In 3 minutes, you have to tell us what were the key recommendations by the SAM, of the SAM opinion on the One Health in the EU?
Well, thank you very much, Joanna. It's a pleasure being here, meeting you all. And actually, rather unusually, it's not that difficult to explain how it all comes together. It's wonderful to see people here from different DGs coming together. And in a nutshell, that is what it's all about. One Health means coming together. And in the recommendations that we have produced here in the opinion, there's 6 main ones. They focus on collaboration, but it's not just collaboration. It's building collaboration into the system. So we need to develop common language, and because we're not just talking about a system, we're not talking just about human health or animal health or our environment, we're looking at the system as a whole, and we need to develop a systems reflex so that we actually looking at a situation when we need to treat plants with pesticides or animals medicines, how does that affect fish downstream or the food chain, or the air that we breathe. There's always a consequence. So the what-if question, the key recommendations is to ensure that we have systems in place that make it easy to develop this reflex, what happens if. And the recommendation specifically, we first need to look at the definition of what One Health is. What is it that we all talk about the same thing? And we need to then move to structure change in administration. That would enable the sort of change that we need, making sure that the right people in positions of influence are talking to each other and they're sharing good practices and so on. And of course, this cannot just happen locally. It has to happen throughout, at the very local level, at home. It has to happen in our homes, but at the EU level and ideally globally. And there's a very important role for Europe to play in joining up policies that exist, or we've heard they exist, and ensure that there are no unintended consequences. So having said that, it's fantastic to see Sandra and Kurt working together on this. And for things to happen, really, we need to change minds. And one of the best ways is to start at the beginning. When you train people, it's the best place, education and training at the many levels that exist. And if we want to develop that reflex, then it has to be there right from the outset. And then lastly, to be honest, it's not a simple thing. We don't have all the answers. We understand some of the connections, but there's a lot work to do before we truly understand it. And research is, without doubt, needed. We need more information, better information of what's happening out there. And we need to expand monitoring systems that Jakob just explained in Italy, for example. And we need to make this information freely available. So the One Health approach can't solve everything, but it would be a great step forward to ensuring human health, a safe environment, and it really would prepare us for the next crisis.
So, Nicole, thank you so much, first of all, for your very insightful and synthetic overview of the policy recommendations. But, of course, the question is how. You mentioned system reflex, you mentioned changing of minds. Now, of course, we're here to implement. This is the next stage. How would you think in 1 minute we can do so effectively by integrating this into various disciplines to integrate the One Health approach and make it effective, of course?
Without a question, change is hard. It takes time. And if you have many actors involved, as we heard, nothing will happen very fast. But policymakers, it's actually the role of the policymakers, they can speed up the process by putting the right conditions in place. And one of the recommendations goes a little bit deeper into how this could be done. So what it needs to be done is to first create a high-level coordination mechanism for One Health. That's quite important. So that way people see change coming from the top. And secondly, we need to strengthen the collaboration, as we have heard, in the institutions, so that we end up with a One Health strategy at the EU level, with the political buy-in from the top as well. And last but not least, go wider. We have to, Europe cannot do this alone. We need to develop a common vision of how the EU can engage with the rest of the world on this globally. And we all know everyone has a lot on their plate, without a doubt, but these issues won't go away, so we have to.
Certainly they won't. Thank you so much for transmitting this advice from the Science Advice Mechanism. And of course, this leads me back to you, Sandra. As we sit all here together as policymakers, what do you take from all of this? And what does it matter to the current DG Santé policies?
Quite a good question, but the introduction of Nicole was perfect because, we went into changing words, which is the superficial first thing to do. We created a One Health Directorate. We work with many DGs, and Kurt is like a brother, so, it's no mystery that we have been working together quite well because, climate change is doing a lot in terms of One Health, vector-borne diseases. We can go into those details. Professor Jacob is much more insightful with the West Nile than I can be. But I would say that there is also two things that I am very proud of. The first thing is we have created this need to have agencies working together. So there is, many agencies that we have, and they have created this group of 5 agencies that are dealing with One Health. All of them have pieces of One Health, and it's a very difficult exercise. I'm grateful to the agencies for that because, science is driven by specialization, but when you want to deal with One Health, you need to come out from the silos. And the final point I'm very proud of is what I call the jumbo meeting. So the jumbo meeting started already with COVID, when I have the privilege basically to have veterinaries working with me, but also public health authorities. And we put them together, and Kurt is looking at me because he remembers this first meeting. This first meeting was not very easy because there isn't that level of trust. And so I go back to what Nicole was saying, that the most important thing is to create, I would say, political awareness so that we are not orphan technically, but also the human bonding between the different strands of work. And that was very important. Many other bits and pieces we have done, but let me say One Health, once you start to look at things with that mentality, you can even look at the construction of a hospital in a different light. So there are many things we're discussing that are closer to the human health, but since I have the privilege of having also the vets, we are also looking at what One Health means in the, I would say, avoidance of transmission of zoonosis to man.
Mm. Sandra, thank you very much for sharing your thoughts and also for explaining to us the challenges of the future actions and where you want to take it. You've mentioned jumbo meetings, you've mentioned trust, you've mentioned the political bonding, all key. Kurt, I turn to you now. You have been sitting very quietly and smiling while Sandra was saying all these grand schemes and the necessity of coordinating across areas, notably, of course, research, health, climate. And we're very lucky to have you here as Director General for Climate Action. So, my question to you, from a climate policy perspective, how can One Health approach help to address the interconnection now, we've changed terms, between climate change and human and animal health and the environment? And how can cross-sector collaboration and cross-fertilization, I hope, be strengthened in this context? Easy questions. In 2 minutes, no, you have 4.
Thank you for your generosity, Joanna. I'm very happy to be here. Thank you for having me. And I'm smiling because I recognize a lot of the discussion that we're having. One Health is not only a valuable and useful framing for policymakers, it's a necessary one. Really also to get us out of our silo comfort zones and work together on really the challenges that matter. And it speaks a lot to climate action, because climate action, you could describe it as taking care of planetary health. We take care of the stability of the planet. But mind you, we don't do this to save the planet. The planet couldn't care less if it warms by 10 degrees. Who cares about it? The people and our prosperity. And that's why we find this One Health framing so terribly important and necessary. Certainly for us to better understand what is happening. The interconnectedness of everything is something we need to better understand. Sandra mentioned the COVID pandemic. We all know where the COVID pandemic came from. Climate change is degrading our biodiversity. That is deteriorating ecosystem resilience, which will lead, unfortunately, to more emergence of zoonotic diseases. And so we have already started applying the One Health framing in the European Climate Risk Assessment report, which we published last year, looking at climate risks across all sectors of economy and society, including health. And we know that Europe is warming at double the global rate of warming. So we better become prepared, and we're not prepared for the coming climate risks. So that requires a lot more interdisciplinary research and literacy on the part of policymakers to understand what is happening. But then we also need to go to interconnected action. We need to make this very actionable. And there, you know that climate neutrality by 2050 and climate resilience is now in European law. So we are working on this. Mm-hmm. But people need to understand that this is about much more than simply cutting emissions. It is not only about decarbonizing our energy system. Mm-hmm. It's really about building a circular economy, and it's about taking care of our nature, because we won't achieve our climate goals without preserving biodiversity and improving biodiversity. And very importantly, we need to become, as I said, better prepared to the growing risks of climate change. So we are working on a new climate adaptation plan, which we will present next year, in which also health will be a very priority perspective in this. We already work together with DG Santé on the European Climate and Health Observatory, for example. Sandra mentioned agencies. We work together with the European Environment Agency in doing this, and we list all the possible best practices for understanding and acting on health and climate change. And we have just this week published the Preparedness Union strategy, which is another attempt at translating the One Health concept into actionable policymaking.
Maybe I now turn towards both Director Generals here. I'm looking at both of you. You have mentioned best practices and you have mentioned examples. And I'm going to ask both of you the same question. And the question is, give us an example. Can you provide us with one each, of course, where climate adaptation and mitigation measures intersect with health? And how can you champion this approach, this collaborative approach of One Health for policymaking within the Commission? Sandra, I start with you.
I have plenty, but before I go there, I want to say that in 2021, when I proposed the climate and environment, or health and climate and environment, I would say observatory, nobody was believing this was useful. So times have changed a lot, Kurt, and for the better. Now, he was very good at giving you the backdrop, but let's go into the fact that with the changing climate, we have vector-borne diseases that are spreading much, much faster. The professor quoted West Nile virus, but we have plenty of them. I would say the floods in Spain. The floods in Spain, when there are these extreme events, you have people that die, and then, you know, you have waterborne disease. So let me say to you, health is never too far from that. We have, I would say, fires. We had fires, but the most striking figure was 2023. At least we calculate 47,000 people died of heat waves, you know. This is not too well accounted for in the minds of people, but the heat waves, when you see these temperatures, especially in the southern part of Europe, is quite disastrous. So I gave you a few examples, but I'm sure that Kurt will be much better at giving much more, but we know that climate, health are quite interrelated.
Thank you, Sandra, for that. You brought it live to us. I think we can relate to a lot of what you said. But Kurt, I have the same question for you.
Well, I pick up on what Sandra mentioned. Heat stress will become really an important challenge for us in Europe. And you know, there's something like the urban heat island effect, which means that the centers of cities are often 6 degrees warmer than the countryside because of the concrete, the cement that holds the heat. So rather than going for massive air conditioners, what we would like to promote is nature-based solutions. More trees in cities, more green facades, more green roofs. So nature can be a very cost-effective solution for this. Now, this is good because it stores carbon, so it helps mitigation. It cleans the air. it helps health. It makes cities more resilient to heat stress. But very importantly also, the more nature there is in cities, the better for mental health. Because people feel better when there is more nature and green around. And we've seen that all in the COVID times when we appreciated being close to nature. So these are typically the win-win solutions that we will want to deploy in line with the One Health objective.
Thank you. We could also relate to what you said a lot, Kurt. But we are approaching towards the end of the debate. But before concluding, I will not let you go. Again, the two Director Generals, unless I put another question. And I want to insist again about the specific recommendations when going back to your respective areas or services. How will you make use of these scientific recommendations when going back to your respective services? What will be the role of One Health in practice to effectively address global health and climate challenges? Very easy questions. Kurt, I start with you.
Yes, Joanna. Well, first I should say we very much appreciate the work of Sam. We have recently had a report on solar modification, radiation modification, and we did a presentation to the staff of DG Klima. On One Health, our teams, Sandra's and mine, are already sitting together. I would like to give two examples where we can practically follow up. One is in the preparation of the next multi-annual financial perspectives, the next budget, where we will have to show that every euro invested leads to more outcomes in policy domains than in simply one. And so I would suggest that we take this forward in the next budget preparation and discussions. And secondly, I think we need to also start applying the One Health framing in policy areas that are a bit under pressure for the moment. I mentioned biodiversity. But also food, for example. Farm to fork was mentioned. There's a lot more that we still need to do there, as Sandra fully knows. These are very sensitive policy areas. So I would suggest we look at how we can take on board those recommendations there.
Very practical and very immediate as well. Sandra, your take.
I could basically duplicate his answer, but I will go into the micro level, meaning that once this report became available, I immediately organized a meeting of all my directors with their heads of unit. And I said, from now on, if you don't give me a good explanation in terms of One Health, you will not be even listened to. It was jocularly said, but believe me.
So much of a joke.
Believe me, the level of resistance sometimes is very clear. So at the end of the day, you have to live what you basically believe in. So for me, it was very clear that this started with COVID. We went that way, and we will go even further. And I think it's for the better of all of us, and not just, something very abstract, a policy. No, it's because, things are happening that are not good. And unless we act in a cohesive way across the silos, across the units, across the directorates, and across everything possible, imaginable barriers, we will not be safe.
Thank you both and thank you all of you for your very practical examples. But I think this is what Europe is about. It's about being effective and making the difference in everyday life. So we conclude here today, and I really would like to thank all the speakers present, the representatives of SAM, namely the chair of the GCSA, Nicole Grobert, and the SAPEA working group member, Jakob Zinstag, for sharing with us the latest evidence, the latest science, for conveying the key policy recommendations on the One Health approach. And thank you, obviously, both DG Sandra Gallina, DG Santé, and Kurt Vandenberger, DG Klima, for giving us very valuable insights on how the scientific advice mechanism can be practically useful and also to inform really in practice EU policies. And finally, many thanks to you, our audience, for staying with us and following today's debate. Thank you very much. Have a good afternoon.
Thank you.
Thank you.